Dr. Adalja, thank you so much for joining us. I just want to get an understanding of when we see cases rise in the U.S., what sort of normal we're reopening we will have more cases, and when do we get to the next step where we really have to consider more lockdowns and more danger?
Well, you have to really look at our two metrics. One is the percent positivity of tests rising. So in places like Texas, places like Arizona, you're seeing the number of tests come back positive increasing. That tells you that the outbreak is accelerating, that there's community spread. And the other one, and I think this is the most important, is what's going on in the hospitals. Are hospitals under stress? Is there a pressure on ICU beds? And I think that's really the best metric to look at. So places like Texas, for example, in Houston or in Arizona, you are definitely seeing that crunch, and you have to think about what's driving those cases. And there you've seen some orders, for example, in Texas about bars being one place where people are spreading. And you see these very targeted types of interventions towards what the epidemiology is showing you is leading to the cases.
What about outside? Because there's this real debate about inside, outside. Are people safer outside? The consensus seems to be yes. Interesting study by the National Bureau of Economic Research suggesting there was no link between the BLM protests and a case count rise associated with it. And I'm wondering whether or not we are now having to draw a very clear distinction between, say, beaches and bars.
I do think it's time to make that distinction. We know that outdoor transmission seems to be less likely. People can naturally social distance there. There is often a breeze that can make droplets kind of dissipate much faster when they come out of people. There's more sunlight, so surface transmission is less because of the UV radiation. So I do think that in everything being equal, outdoor is safer than indoor. And I think we're seeing that reflected in the epidemiology and the fact that the Black Lives Matter protesters did not really measurably lead to the increased case count.
I have to be honest, I was one of those beachers yesterday that sort of is those pictures where you're covered with people on a beach, but it didn't feel as unsafe as it would have been, say, in a department store, to your point. So from the market's perspective, though, we're just concerned about what it means for then economic activity. So if we're making the distinction between beaches and bars, can we have more targeted lockdowns or ways to fight clusters rather than a full-on shutdown and loss of economic confidence?
I don't think that anybody really has the stomach or the will to do any kind of economic shutdown. And I don't think it actually is warranted by the data. We never wanted to do these blanket shutdowns. It was just that governors were left in such a horrible place after kind of failures at the federal level in January, February, and March with testing and being able to know who was infected and who wasn't, that this was the only blunt tool that they had. So I think now moving forward, you're going to see more targeted approaches, looking at the case contact investigation results and seeing where are people getting infected, what's driving the epidemic, and then addressing those issues. And that's why you've seen, for example, in Florida and Texas and even in Pittsburgh, in the Pittsburgh area, where they've really focused on bars as being a major focus of transmission. And I think this may change for different parts of the country, and it may be different in different time periods. But I do think this nuanced, more surgical, tactical approach is going to be what we see.
Gilead's remdesivir is going to cost $2,340 for a 5-day treatment. Is that going to be a problem?
I don't think it's going to be a problem. That's sort of in line with what we pay for anti-infective drugs that we use for bacterial infections, for example, new antibiotics. I think it's in line with this. There are measures in place for hospitals to be able to afford to purchase this and for patients and their insurers to be able to get access to it. Remdesivir isn't a knockout punch. It's not for everybody, but we are using it. And I do think that that pricing seems to be in line with what we would expect for an anti-infective drug like this.
On the same path as treatment, in Texas, for Houston in particular, about a quarter of the residents under 65 don't have health insurance. There's been sort of a push to move away from the Affordable Care Act in D.C. What's the implication if we have some kind of loss of insurance in the middle of COVID when you do have treatments that are so expensive?
I think it's important to remember that whatever issues people have with the Affordable Care Act, that needs to be put aside during the middle of a public health emergency. And we need to make sure that people can get treated, can have no barriers to care, because we don't want this to spread. We don't want the damage to increase. So I do think if there are discussions to have about the Affordable Care Act, they should be happening outside of a public health emergency, not in the midst of it when people are relying on access to hospitals and doctors in order to keep themselves safe from this pandemic.
Yeah, and it may be a small price to pay if you consider the economic advantage that you may gain as a country over the long term as a result of using this properly. Just one final quick question. I'm trying to understand the long-term prognosis here for a country like the United States. What is clear is that there is pent-up demand for people when they come out of lockdown to go and do all kinds of things. How do we change long-term behavior at this point? Are there studies we can look at to understand how behavior can change? Because clearly the virus is going to be with us for a while. Vaccines, while there was a lot of sound and fury about them a few weeks back, that seems to have dissipated. How do we change behavior on a more medium-term basis?
It's a very difficult thing to do because people have different risk perceptions. They have different individual values that they're going to pursue. And there's not one universal blanket recommendation that you can give people other than to realize that we're in a pandemic and you can't behave as if there is no pandemic viruses out there. Every activity we do, every social interaction we have has the chance of either acquiring or transmitting this infection. And you can't just think that you're immune from it. And you have to really be mindful of the fact that you can become an unwitting chain in the transmission belt that leads to help a person that has a higher risk for hospitalization getting infected from you. And I think that this is something that's hard to drill into people. And I think that the fact that the lockdowns were so aggressive early on did cause this quarantine fatigue, and people basically all turned 21 on the same day is what it seems like. And I think that's sort of the result of the fact that we were pretty blanket early on. So I do think this surgical tactical approach and telling people we're only going to restrict those activities when they're leading to cases is one way to get people to be much more mindful of it. But it's going to be a major challenge.